Welcome to the second video in our pelvic floor and core fundamentals series, Pelvic Floor 101. If you haven't watched Breathing 101 yet, please start there. This video is going to build on that one. So, start out, what is the pelvic floor? We have our female pelvis. We're going to flip it on its back here. We have the front of the pelvic floor or the anterior pelvic floor. We have the back of the pelvic floor or the posterior pelvic floor. And then we have the superficial layer, which is the layer that's closest to the outside of the body. And then we have the deep layer here, which is more up inside. And you can see that if we take it off here. So these superficial muscles here are in control of urine and feces and gas, so continence. And then the deep muscles hold up your organs or the baby if you're pregnant. So, okay, I'm sure you've heard of a kegel. A kegel is just a fancy word for a pelvic floor contraction. So, sometimes women are taught to stop the flow of urine or to stop gas for how to do a pelvic floor contraction. And that's a great place to start, but it's not always the whole picture. So remember, when we do a pelvic floor contraction, we want to include the front and back and the superficial and the deep layers. So my favorite way to remember how to include all of those is to start with a squeeze and then progress to a lift. So my favorite cue for that is to imagine a string inside pulling up on the vagina and then a string on the inside pulling up on the anus. And those two, you'll start with the squeeze and then you will pull up on both of those strings. And that is what constitutes a pelvic floor contraction. Some other cues that I think are helpful are either like you're sucking up a thick smoothie with a straw, or sucking up a blueberry, or even a jellyfish motion, how they swim. You're pulling up and in with those muscles. Okay, so it's common for women only to activate the back of their pelvic floor. So when we're doing our pelvic floor contraction, you want to make sure you're including the front and the back. So the front will get that vagina area, the back will get the anus area, and the superficial muscles are the squeeze, and then the lift is the deep portion. Okay, so if you have prolapse, make sure you're really focusing on that deep layer, that lift, because that is what needs strengthening for you, for sure. If you're leaking urine, you probably need to strengthen the front of your pelvic floor. If you are unable to hold in gas or feces, it's probably the back of the pelvic floor for you. And we're going to talk a little bit more about that as we go on. So we're going to find our pelvic floor together. So go ahead and lay down with me. And what we're going to do is we're going to lay on our side and we're going to put our hand right here between our pubic bones or our sits bones, and we're going to feel our pelvic floor. Okay, so that's what we're doing here. Go ahead and lay on your side. If you want to use bolsters, the towels like we did in the last video, go right ahead. So you're going to bring your hand, put it right between your sits bones there with your hand on your pelvic floor. And we're going to go ahead, excuse me, and do a nice big 360 inhale like we talked about in the last video. And you can feel that pelvic floor expand on the exhale or on the inhale, and on the exhale it should recoil a little bit. So go ahead and take a nice deep breath with me. Inhale. Exhale. Do you feel your pelvic floor expanding? Let's go ahead and take a couple more breaths. Inhale. Exhale. One more. Inhale. Exhale. So if you don't feel your pelvic floor expanding, it could be one, you need more practice breathing, which is okay, or two, it could be because you have a tight pelvic floor and it's having trouble expanding. So either of those could be the options. So now that we've found the pelvic floor, let's practice some pelvic floor contractions together. So put your hand back between your sits bones there. Excuse me. And we're going to practice having a nice 360-degree inhale. And on the exhale, we're going to pull that blueberry up and in, pull those strings up and in, okay? Go ahead and inhale with me. Exhale. Pull up and in. Inhale. Exhale, pull up and in. Inhale, relax. Exhale, pull up and in. Okay, and you can practice that as many times as you need to. We're also going to practice here, putting our hand on our pubic bone to feel that lift in the front. So what you're feeling for is right on your pubic bone, which is right here. You should feel these muscles lift up a little bit towards your belly button. So that's what we're feeling for. So go ahead and put your hand on your pubic bone here. Take a nice inhale. Exhale. Lift that pubic bone up towards your belly button. Relax. Inhale. Exhale. Pull that pubic bone up and in towards your belly button. Okay, and if you can't feel those yet, it takes some practice. Also, a good thing that I'll put a plug in for you a few times during this video is if you can, go see a pelvic floor physical therapist. They can do an internal exam and help you really feel what your pelvic floor is doing instead of just a guess from you. All right, so now we've learned pelvic floor contraction. Now we're going to move on to more about the pelvic floor. So for a muscle any muscle to function properly, we want it to have a full range of motion, which this is the case for your bicep. If you walk around with your bicep clenched all day long, and then somebody's like, oh, hey, here, hold this gallon of milk for me, that's going to feel really heavy and you're probably not going to be able to hold it. The same thing is true with our pelvic floor. If we're walking around carrying tension all day long and then we sneeze, we're going to leak. So we want to make sure that in everyday life, we're not contracting our pelvic floor. We're just relaxing unless we're using some effort. And we'll talk more about that in the next video, so don't worry about that yet. What we're focusing on now is that we're not holding tension just in everyday life. And in general, you just don't want to hold tension in any muscle. So I like to think of the pelvic floor as like the 5 levels of a house. So level 1, ground level, is going to be just at rest, like we talked about, not holding any tension. And then there's levels 2, 3, 4, 5 going up in that house. And that is that lift that we talked about with our pelvic floor contraction. And then we have the basement, which is that natural expansion on the inhale. And then we have going out the basement window, which would be bearing down. Like if you're having a bowel movement or if you are pushing out a baby, that would be bearing down. Okay, so let's go ahead and practice each of those layers of the house. We're gonna start with our nice inhale here. So go ahead and inhale with me. Feel that go down into the basement. Then exhale. Come up to level 1, 2, 3, 4, 5, and relax. Okay, let's do that one more time. Inhale. Feel it go down to the basement. Exhale. 1, 2, 3, 4, 5. Okay, so those are the different levels of our pelvic floor house. So levels 2 through 5 are an active pelvic floor contraction. And then, as I mentioned before, bearing down is out the basement window. And bearing down is something we don't want to be doing in everyday life. It can cause prolapse, or if you have prolapse already, it can make it worse. So that's why we want to learn not to bear down with exercise, with lifting, with bowel movement, or anything like that. And we'll again talk more about that in the next video. But if you're having trouble knowing if you're bearing down, you can go ahead and get in this position again, and then you can bear down like you're gonna pass gas or bowel movement, and you can feel what that really feels like and whether or not you're doing that. Another way to know if you're bearing down is if when you lay down, it might be kind of hard to tell, but when you bear down, your lower belly will pooch out a little bit, like that. Okay, and we will talk more about that again next time. So, next we are going to talk about a tight pelvic floor and a weak pelvic floor. So you don't have to have all of the symptoms that I'm talking about in each list to have a tight pelvic floor or a weak pelvic floor. And honestly, sometimes you have a little bit of both. So just kind of, if you have some symptoms of both, that's very common. All right, so I'm just gonna read off some symptoms of a tight pelvic floor for you. 1, tailbone pain. Having a hard time starting a stream of urine. Like you sit down and you really have to think about, okay, I'm gonna relax and now I'm gonna start, okay? You might also have your urine stream kind of stop and go. You might have a hard time completely emptying your bladder, or feel the urge to urinate soon after you use the bathroom. You might dribble urine when you're standing up from the toilet. You might be unable to pass gas without bearing down. You might have painful penetration, whether that is a tampon or sex or a gynecological exam. You might have leaking with jumping, running, sneezing, coughing. We call that stress incontinence. You might have chronic constipation just because those muscles are tight. You might have an inability to feel that pelvic floor expand on the inhale, kind of like we talked about earlier. If you're having a hard time feeling that pelvic floor expand, it could be because it's tight and your breath has a hard time getting down to those tight muscles. Or you could have a hard time feeling your pelvic floor contract with exercises because it's already contracted. So those are some of the signs for tight pelvic floor. Now some of the symptoms for a weak pelvic floor. You might leak urine when you're coughing, sneezing, laughing, running, kind of like we already talked about. You might have a hard time making it to the bathroom in time to urinate. We call this urge incontinence. You might be passing gas from either your anus or your vagina when bending over and lifting. You might have tampons that dislodge or fall out. You might have a distinct bulge at the vaginal opening. This can be prolapse. You might have a sensation of heaviness in the vagina, or you might have just heaviness or dragging feeling in your pelvis. Okay, so those are just kind of some symptoms to consider. If you notice pelvic floor or symptoms of pelvic floor tightness, then you're going to want to back off and stop doing as many Kegels. Also, you want to make sure you're focusing on deep breathing. So, sorry, I'm distracted. I think my baby woke up. So, you want to focus on deep breathing daily if you have pelvic floor tightness. So if you're looking for some exercises for deep breathing, for pelvic floor relaxation, check out my birth prep playlist. I have 10 follow along videos there that'll guide you through pelvic floor relaxation, and they're great whether you're pregnant or not pregnant, so check those out. And then it is possible for you to have a weak pelvic floor and a tight pelvic floor, but if you have only a weak pelvic floor, you will need some pelvic floor strengthening. All right, as I mentioned before, if it's possible for you, schedule a visit in person with a pelvic floor physical therapist, and they can really help you figure out what's going on with your pelvic floor. And then before we wrap up, I just want to give you a few general tips for just your pelvic floor in everyday life. So what should we be doing when we urinate? Well, we don't want to bear down. you want to just simply sit. So don't hover over the toilet. You want to sit, relax, and just let that urine come out naturally without bearing down. And the same thing for a bowel movement. You shouldn't have to bear down to have a bowel movement. Your stool should be soft enough that it comes out on its own without bearing down. If you have chronic constipation, then what you really want to focus on is getting enough fluids in your diet, exercise regularly, and also especially getting more fiber and varying the types of fiber that you have. So you want to increase the plant sources of fiber in your diet, increase those whole grains, and make sure to vary those types of fiber. And that is what's best for our intestines to help get things moving along. And then on that note, that's everything for today. So thank you for joining me for Pelvic Floor 101. I'm really excited to be teaching these things to you. They were really helpful for me when I learned them. I hope they can be helpful to you. Again, if you have any questions, don't be afraid to reach out. Nothing's embarrassing. No questions too weird. I really love hearing from you. Feel free to comment below. Feel free to come over and message me on Instagram or Facebook over at Small Simple Strong, and I am happy to answer any questions that you have. And I will see you over on Deep Core 101.